Hi, I'm Dr. Troy Glembot. Our mission is to improve the health of obese people by providing comprehensive medical, surgical, dietary, and educational intervention. What is the disease of obesity, and why do some people suffer from size? In its simplest form, obesity is a disease that's characterized by the excess storage of body fat. We know that it's multifactorial, lifelong, progressive, and potentially life-threatening. It is also very expensive. When we talk about the disease of obesity being multifactorial, we mean there are several different causes of why people suffer from this disease. There are genetic factors, behavioral factors, and environmental factors. When we talk about environmental factors, we're talking about the way we live our life, in that we don't burn a lot of calories. All of these things contribute to why people may suffer from obesity. When we talk about the disease of obesity, you'll frequently hear us use this term called body mass index. That's simply a way we can compare a person's weight to their height. For example, if a person weighs 250 pounds, is that person considered obese? Well, it depends upon how tall they are. If a person's 6 foot 2 inches tall and weighs 250 pounds, that's very different than a person who's 5 feet 2 inches tall and weighs 250 pounds. You can go to our website, valleyhealthlink.com/bariatrics, and calculate your own body mass index by entering your height and weight into the calculator. A person is considered to have a healthy body mass index if it is between 18.5 and just under 25. A person is considered to be overweight if the body mass index is 25 to just under 30. And obese if the body mass index is over 30. A person is considered to be severely obese if the body mass index is more than 35, and morbidly obese if the body mass index is over 40. Sometimes you'll hear people use the term super obese for those individuals who may have a body mass index of 50 or more. So what is the real problem with being heavy? Well, it's important to understand that the disease of obesity is potentially life-threatening. When we compare a person's body mass index to the risk of dying, we see that the risk of dying increases as body mass index increases. By the time a person has a body mass index of 40, they are 2.5 times more likely to die of obesity-related diseases than a person with a healthy body mass index of 18.5 to 25. Well, why is that? Why is it heavy people are more likely to die than people with a healthy body mass index? The reason is what we call obesity-related comorbidities. These are diseases that are made worse by being heavy. It's important to understand that these obesity-related diseases literally affect every aspect of a person's life. There are a long list of diseases that are made worse by being heavy. Now, some of these diseases are not going to be a surprise to many people. For example, many heavy people have problems with cardiovascular disease like high blood pressure. In fact, it's no surprise that about 43% of heavy people have high blood pressure. Obesity can also cause an enlargement of the heart. As the heart gets larger, the pumping function of the heart can deteriorate, and this may lead to congestive heart failure. There's also a variety of cholesterol problems that can happen as a result of being heavy. Obesity has been determined to be the most common cause of type 2 diabetes in adults today. Nearly 33% of heavy people have some form of type 2 diabetes. There are a variety of lung problems that heavy people may suffer from. These may include a higher risk for pneumonia, asthma, and many heavy people have a condition known as obstructive sleep apnea. Obstructive sleep apnea is a condition where you literally stop breathing while you're asleep. The disease of obstructive sleep apnea is potentially life-threatening. Because it is so common in heavy people, I urge everyone to get tested for obstructive sleep apnea. Heartburn disease is also common in heavy people, as is gallbladder disease. Now, there's a long list of things you haven't heard of that are associated with being heavy. One of these things is something called pseudotumor cerebri. This is a condition where the pressure inside the brain is elevated and is associated with chronic headaches and visual disturbances. Women who are heavy can develop serious complications during pregnancy. Some of these things include preeclampsia that can threaten the life of the mother and the baby, gestational diabetes, where the mother may become diabetic during pregnancy, and overall there's an increased risk that the baby will not survive to term in a woman whose body mass index is 40 or more. One of the things we've learned in the past 20 years is that virtually all cancers are more common in heavy people. We're not exactly sure how this happens, but we know it's true, and it's particularly true for breast cancer, colon cancer, prostate cancer, and uterine cancer. In fact, the link between breast cancer and obesity is as strong as the link between breast cancer and having a mother or sister with breast cancer. Urinary stress incontinence is also more common in heavy people, as is infertility and sex hormone defects such as polycystic ovary syndrome. But the disease of obesity is much more than just a long list of doctor terms. It's a disease that people suffer with every day. Things such as being able to go to a sporting event and go through the turnstile. Heavy people just can't do that because of their size. Another example is sitting in a restaurant chair or even traveling in an airplane or a bus. These pose special challenges for heavy people. Going to a public building and simply climbing a flight of stairs can mean the difference between getting into that building and not getting into that building. And it's not right and it's not fair, but heavy people are discriminated against because of their size. The disease of obesity is expensive. The overall health costs for a person who has a body mass index of 30 to 35 are 25% higher than those people who have a healthy body mass index. And that cost nearly doubles for individuals with a body mass index of 35 or more. They will spend 44% more money on their health care than a person with a healthy body mass index. And that's simply due to the disease burden associated with their condition. And it should be noted that things like high blood pressure and heartburn disease and cholesterol, they all get worse as a person gets heavier. The National Institutes of Health met in 1991 to try to figure out what's the role for surgery to help people lose weight. They said, first of all, if you're suffering from size, you ought to try diet behavior modification to achieve a healthier weight. But they recognized the fact that for people who are 100 pounds or more overweight, this probably will not work. They said that for those people who are properly motivated, gastric restrictive or gastric bypass type operations are appropriate. However, if you're going to have bariatric surgery, you need to go to a practice that's dedicated and experienced in weight loss surgery and has a multidisciplinary team format. In other words, having the surgeon work with dietitians, specially trained nurses, and behavioral health therapists who all work together to ensure the best possible outcome. And finally, if you're going to have bariatric surgery, you're going to be in a special group of people who need lifelong surveillance. Here at Winchester Medical Center, virtually all of our procedures are done laparoscopically. We do 4 different types of procedures, 2 of them restrictive, and 2 of them combine restriction and malabsorption. The 2 restrictive procedures are the adjustable gastric band and the sleeve gastrectomy, while the 2 combined procedures we offer are the gastric bypass and the duodenal switch. The adjustable gastric band procedures can only be done laparoscopically. It involves an implanted medical device, and the average excess weight loss at 1 year is about 40%. The band was popular because it was touted as having the lowest 30-day complication rate among all bariatric surgical procedures. And while that is true, we have seen the complication rate on day 31 and forevermore after that is actually higher with the adjustable gastric bands than with the other procedures. Because of this, the band procedure is not done very commonly anymore. The sleeve gastrectomy has become the second most commonly performed weight loss operation we do here at Winchester Medical Center. It has the advantages over the band in that it does not require an implanted medical device, it requires no adjustments, and the weight loss with a sleeve is better than with the band. On average, people will lose about 59% of their excess weight with a sleeve gastrectomy. The second type of operations that can be done to help people lose weight combines some restriction and some malabsorption. The first example of this is the duodenal switch. It can almost always be done laparoscopically, and this type of operation has been around for over 20 years. It involves removing part of the stomach and bypassing long segments of the intestine. Overall, it has the best results from a weight loss standpoint. People will lose over 70% of their excess weight at 1 year after a duodenal switch. This procedure offers some of the best long-term sustained weight loss of all the bariatric surgical procedures. The final example of a combined procedure is the gastric bypass. It can almost always be done laparoscopically. It is the most commonly performed weight loss surgical procedure done here at Winchester Medical Center. On average, people will lose about 67% of their excess weight at 1 year after surgery with the gastric bypass. It is important to understand that all weight loss surgical procedures are major abdominal surgeries, and even though they may be done laparoscopically, there are risks associated with these procedures. Not all patients have the same risks of complications. For example, people who have a body mass index of 50 or more are at a higher likelihood of having complications than those who have a BMI of less than 50. Men have a higher complication rate than women, and people who are 45 years old or older have a higher rate of complications than those younger than 45. People who have a history of high blood pressure, obstructive sleep apnea, or who have had a history of blood clots in their legs also have a higher complication rate. Proper nutrition is very important after bariatric surgery. Our dietitians will work with you to provide you information on what types of vitamins and supplements to take after your surgery. Each patient must be compliant with taking their vitamins and nutrients as recommended. Now, for years we've known bariatric surgery can help people lose weight. But the real question is, does it matter? Does it help them live longer? And the answer to that question is yes. Back in 2004, a study was performed that looked at over 1,000 morbidly obese people who decided to have bariatric surgery and compared them to almost 5,500 morbidly obese people who did not have surgery. This study followed these two groups of people out for 5 years, and at the end of that 5-year period, they saw an 89% reduction in the risk of dying among those individuals who had bariatric surgery compared to those individuals who did not have bariatric surgery. There was also an increased risk of cancer among those people who did not have surgery compared to those people who did. And the incidence of cardiovascular disease was almost 27% in those people who did not have surgery versus under 5% in those people who did have surgery. Now, the results of this study were so unbelievable, it prompted 2 more studies to evaluate the same questions. One study was done in Sweden, and the other one was done in the United States. And these 2 studies showed the exact same thing. They looked at 2 groups of heavy people, one group who had bariatric surgery and one group who did not, followed them out for a period of time, and they saw the exact same thing. The morbidly obese people who had bariatric surgery were more likely to live longer than those morbidly obese people who did not have surgery. Well, why is that? Why is it morbidly obese people who have bariatric surgery are more likely to live longer than morbidly obese people who do not have surgery? Well, if you think back about that long list of obesity-related comorbidities, those diseases that are made worse by being heavy, those things tend to either get better or go away with sustained weight loss after bariatric surgery. People just feel better. Their quality of life is improved and their ability to get up and move around is better. And I don't know if depression causes obesity or if obesity causes depression, but I know that one of the best treatments for a heavy person who suffers from depression is sustained weight loss. Thank you for your time. If you'd like to have bariatric surgery at Winchester Medical Center, you'll meet either myself or Dr. Weedor, and we'll introduce you to the entire team of people whose sole job is to make sure that you have a safe and successful experience.